What's up everyone, Dr. Mike here, ready to share some important information. Today we're diving into Cytomegalovirus, or CMV, a very common virus. A virus most people get, but surprisingly few know about its existence. For healthy people, CMV is usually harmless and often symptomless, but it's incredibly common. Over half of adults have had it at some point. It spreads easily, especially among young children and those with weakened immune systems, making them more vulnerable. So why talk about it? Because understanding how CMV spreads is crucial for protecting those most at risk. In this video we'll break down the 5 main ways CMV is transmitted, from close contact all the way to medical procedures. Let's get started. The most common way CMV spreads is through direct contact with bodily fluids. It's a virus that hitches a ride in the liquids our bodies produce. Understanding this primary pathway is key to preventing its transmission. Saliva, urine, blood, semen, vaginal fluids, and breast milk. These fluids can carry the virus, even when the person shedding them feels perfectly healthy. Everyday moments, kissing your child, a seemingly harmless act of affection, sharing utensils, which happens all the time in families, or wiping a runny nose, a common occurrence with little ones, can all transmit CMV, especially in families with young kids. Young children in particular are often asymptomatic carriers, making them a significant source of transmission. Daycares are hotspots, environments where CMV can easily spread due to close proximity and shared items. Kids share toys, put them in their mouths, a natural behavior for toddlers, and caregivers change diapers all day. This creates ample opportunity for the virus to spread if proper hygiene isn't maintained. Saliva is a big culprit. It's often involved in the innocent interactions we have every day, not just kissing but sharing drinks, toothbrushes, or lip balm. These seemingly small acts can significantly increase the risk of transmission. Urine is another, a less obvious but equally important source of transmission. Changing diapers without proper hand washing can lead to infection. It's a critical step that's often overlooked, but it's essential for preventing the spread of CMV. CMV doesn't spread through the air like the flu. It's not an airborne virus. It needs direct fluid exchange, so it's most common among close contacts. This means that family members, partners, and caregivers are at the highest risk. The more frequent or intense the contact, the higher the risk, the more opportunities there are for fluid exchange. Think repeated sharing of utensils or passionate kissing. These intimate moments, while important for connection, can also facilitate the spread of CMV. Hand hygiene is your best defense. It's the simplest and most effective way to break the chain of transmission. Wash with soap and water for at least 20 seconds, ensuring you cover all surfaces of your hands. After changing diapers or before eating. These are crucial times to prioritize hand washing. Most people spreading CMV don't know they have it. They're asymptomatic, meaning they show no signs or symptoms of infection. Healthy kids and adults often have no symptoms but can still shed the virus. This silent shedding is what makes CMV so pervasive. That's why CMV is so successful. It's a master of disguise, spreading without detection. It spreads quietly through our closest relationships. It leverages the very bonds that make us human. The key is not to fear affection, but to be mindful, to understand the risks and take appropriate precautions, especially if you or someone in your home is pregnant or immunocompromised. These individuals are at a higher risk of serious complications from CMV infection. Simple changes like not sharing utensils and washing hands are easy to implement and can significantly reduce the risk of transmission. Can make a big difference. These small adjustments can have a profound impact on the health and well-being of your loved ones. Remember, it's about protecting the vulnerable, not disrupting family life. It's about finding a balance between connection and caution. Education and awareness are the best tools we have. The more we know about CMV, the better equipped we are to protect ourselves and our families. By knowing how CMV spreads, you can take small steps to reduce risk. Knowledge is power, and in this case, it's the power to protect. Focus on hand washing, making it a regular and thorough practice, and avoiding direct saliva or urine contact. These are the 2 primary routes of transmission to be aware of. CMV thrives on our social nature, but smart habits can keep it in check. We can still enjoy our relationships while minimizing the risk of infection. It's not about fear. We don't want to live in fear of CMV. It's about informed choices. It's about making conscious decisions that protect ourselves and our loved ones. So next time you're caring for a child, remember, a little awareness can make a big difference. A little extra hygiene goes a long way. It's a small investment that yields significant returns in terms of health and well-being. Let's move on to another major route of transmission. exploring how CMV can also be passed from mother to child during pregnancy. CMV is also a sexually transmitted infection, found in semen and vaginal fluids. Unprotected sex with an infected partner gives the virus a direct route into your body. Most people with CMV don't know they have it. There are often no symptoms. You can get CMV from a partner who was infected as a child or from a new strain through a new partner. Barrier methods like condoms significantly reduce the risk of CMV and other STIs. CMV isn't usually discussed as an STI, but it's common and deserves attention in sexual health conversations. For healthy adults, CMV from sex is usually mild or unnoticed, but it can be serious if passed to someone vulnerable, like a pregnant partner. Even in long-term relationships, safe sex matters if there are health concerns or pregnancy plans. Open conversations about sexual health, testing, and protection are key. Other STIs can increase CMV risk by causing inflammation or sores, making it easier for the virus to enter. Sexual contact is a major route for CMV in adults, often silent but preventable. Use condoms, communicate, and stay informed to protect yourself and your partners. Awareness is power. Don't let CMV fly under the radar in your relationships. Remember, it's not about fear, but about making smart, safe choices. If you're planning a pregnancy, talk to your doctor about CMV risks. Let's look at another critical pathway: mother-to-child transmission. One of the most serious and concerning ways CMV spreads, and arguably the most impactful, is from mother to child, especially during pregnancy, representing a critical pathway for the virus. This transmission route can have profound consequences. If a mother gets CMV for the first time while pregnant, meaning it's a primary infection, the virus can cross the placenta, the vital lifeline between mother and baby, and infect the baby. This is congenital CMV, a condition that arises when the virus is transmitted in utero. Congenital CMV is the most common viral infection babies are born with, often exceeding other well-known infections, and can cause a range of health issues, including hearing loss, vision problems that can affect development, intellectual disability, impacting cognitive function, and in the most severe cases, even stillbirth, highlighting the gravity of the infection. The risk is highest if the mother's infection is new during pregnancy, making it a primary infection during this vulnerable period since her body hasn't built up antibodies, the protective proteins that fight off the virus and offer some level of immunity. CMV can also be passed during birth through vaginal secretions, which the baby comes into contact with during delivery, or after birth through breast milk, offering another potential route of transmission from mother to infant. For healthy full-term babies, CMV from breast milk is usually not harmful, as their immune systems are more developed. But for premature or low birth weight infants, whose immune systems are still fragile, it can be dangerous, posing a greater risk. Pregnant women can lower their risk of contracting CMV and potentially passing it to their baby by avoiding sharing food, drinks, or utensils with young children, who are often carriers of the virus, and by washing hands thoroughly with soap and water after changing diapers or wiping noses, common sources of CMV transmission. Small changes, like kissing a child on the forehead instead of the lips, where saliva is exchanged, can help protect the baby from potential CMV exposure. Routine CMV screening in pregnancy isn't standard practice in many places, but awareness is crucial for informed decision-making and proactive prevention. If you're pregnant and develop flu-like symptoms, which can sometimes mimic CMV infection, talk to your doctor promptly. The emotional impact of congenital CMV can be huge for families, often leading to stress and uncertainty, so support and education are vital for navigating the challenges and accessing appropriate resources. Protecting babies starts with informed parents and caregivers who understand the risks and preventive measures. Simple hygiene steps, consistently practiced, can make a big difference in reducing CMV transmission during pregnancy. Let's move on to how CMV can spread through medical procedures. Another important aspect to consider. CMV can also be transmitted through blood transfusions and organ transplants. The virus hides in white blood cells and tissues, so if a donor has CMV, it can be passed directly to a recipient, especially risky if the recipient has never had CMV. Transplant patients are especially vulnerable because their immune systems are suppressed to prevent organ rejection. In these patients, CMV can cause severe illness, pneumonia, hepatitis, colitis, even blindness or organ rejection. That's why both donors and recipients are tested for CMV before transplants. High-risk patients often receive antiviral medication to prevent CMV disease. For blood transfusions, especially in premature infants or cancer patients, blood banks provide CMV-safe blood, either from CMV-negative donors or by removing white blood cells. These precautions have made transplants and transfusions much safer. Managing CMV risk is a cornerstone of modern transplant medicine. It's a reminder that medical advances come with risks that must be managed carefully. For most people, this route isn't a concern, but for transplant and transfusion patients, it's critical. Awareness and proactive care save lives. Now let's talk about a less common but possible way CMV can spread: contaminated surfaces. CMV, like many viruses, can survive for a limited time on surfaces. Studies have shown it can persist for a few hours, sometimes longer, depending on environmental conditions like temperature and humidity. This includes surfaces like toys, changing tables, or countertops, common areas where contamination can easily occur. These contaminated objects are called fomites. Fomites act as intermediaries, potentially carrying the virus from one person to another. If saliva or urine from an infected person gets on a surface, even in small amounts, and someone else touches it shortly after, and then touches their mouth, nose, or eyes without washing their hands, transmission is possible, though not guaranteed. This route, known as indirect contact, is generally less efficient than direct contact with an infected person. But in places like daycares, where hygiene practices may vary, where surfaces are frequently and constantly contaminated with bodily fluids, the risk of fomite transmission goes up significantly. Regular cleaning and disinfection of high-touch surfaces in both homes and childcare centers is a crucial step helps break the chain of transmission and reduce the viral load on surfaces. At home, focus your cleaning efforts on areas that are most likely to get contaminated with saliva or urine. Changing tables, toys, especially those that go in mouths, and high chair trays. Hand washing remains your best defense against CMV and many other infections. Even if you inadvertently touch a contaminated surface, washing your hands thoroughly with soap and water before touching your face or eating effectively stops the virus from entering your system. Don't stress about sterilizing every single item. Focus on cleaning high-risk zones and maintaining good personal hygiene. Remember, the main risk of CMV transmission is still direct contact with infected bodily fluids, not surfaces. But understanding the fomite transmission route helps you prioritize your cleaning and hygiene efforts effectively. Think of risk as a hierarchy. Direct fluid exchange like kissing or sharing utensils is the highest risk, while fomite transmission is a lower but still present risk. Smart, targeted cleaning of frequently touched surfaces and diligent hand washing are far more effective in reducing transmission than trying to disinfect every single surface in your home or daycare. For most people, in their everyday lives, worrying excessively about CMV lurking on public doorknobs isn't usually necessary. The key is to maintain reasonable, focused hygiene practices, especially if you have young children in daycare, who are more likely to be exposed, or if you have someone at higher risk of complications from CMV at home. Simple actions like regular hand washing and targeted cleaning disrupt this transmission pathway and add another important layer of protection for yourself and your family. Let's wrap up this section by discussing who needs to be most aware of the risks associated with CMV. So, who should be most alert about CMV? Pregnant women, especially if it's their first infection, are at highest risk, since congenital CMV can seriously affect the baby. Infants and young children are both at risk and the main source of community spread. Immunocompromised people, like transplant recipients or those with advanced HIV, can get severe disease. Healthcare and childcare workers are at higher risk due to frequent close contact. Understanding how CMV spreads empowers these groups to take simple, effective steps to protect themselves and others. Stay informed, practice good hygiene, and let me know in the comments what you want to learn next. Stay safe.